All right, Red Nation. Today we're going to be talking about magnification in radiology coming up here at How Radiology Works. Let's draw our X-ray tube again. And remember, the X-rays come out in a divergent manner where they're spreading out like a cone from the X-ray tube. And typically, let's imagine you're able to position well such that your X-ray beam is perpendicular to a bone, which you'd like to make an image of. Then imagine that our central ray is coming down here and our detector or our image receptor is down here in this plane right here. And you can just trace out the rays, for instance, that define the edge. And we can look at either of these triangles. We actually have a couple triangles here. We want to define the magnification, which is actually just the change in size. The magnification is how large is the projection of that bone. We're calling that x2 here. X is just a given distance. Magnification is how large is the size of that bone on the image receptor divided by how large is the size of that bone within the patient itself. This is going to be the magnification in terms of the size of the bone. And then we could do the same thing on the other side of the bone. It's convenient if we split it up into two triangles. We can do one side and the other side. But this magnification effect is applying the same on both sides. If we just look at this one side, we can make our similar triangles and show what the magnification is. If we look at this triangle here up at the top, this is the source to the object distance. We call this the S to object distance. And then this distance here from the source all the way down to the image plane, we call that the SID. You can see actually this angle right here in this triangle is actually the same. These are what's called similar triangles. That means the ratio between these two values is the same as the ratio between these two values. Wherever we see x1, we could also plug in the source to object distance. And wherever we see x2, we could plug in the source to image distance. Again, magnification is just the SID divided by the SOD. Then how does this actually affect your image? Then when you are actually having changes in the magnification, this will lead to the object projecting to a larger size on the detector. A lot of times for standard radiography, we want to actually have the focal spot project into a small size. Right now, we're not talking about the focal spot here, but there's a separate effect related to the focal spot that we have a video about, that you can see that you actually like to reduce your magnification to have the focal spot project into a small size. And that's why the magnification for standard chest radiography is typically close to 1. You end up actually imaging with the patient very close to the image receptor. If you have the patient very close to the image receptor, that means the SOD and the SID are very close to one another. In that case, the magnification is getting closer to 1. In some other scenarios, like in interventional imaging, in that scenario, you typically have a larger magnification because you're working in this interventional setting and you need to be able to move and rotate the X-ray tube and image receptor around. You typically have a geometry where the magnification is larger in that interventional setting compared with your standard radiography. There's also some scenarios where you try and intentionally do magnification for breast imaging, for instance. But just in general, you want to be keeping this account. Just in general, you want to keep this in mind. If someone asks you to figure out what the magnification is for any system, it's just as simple as this. the source to image distance divided by the source to object distance. And now that you understand the basics of magnification, the next thing you really need to understand is if this bone is not perpendicular to this central ray, what are the effects that can actually happen? See our video about foreshortening, for instance, coming up here at How Radiology Works.